So I'm gonna be doing the Godfrey's position, which tests for the PCL. So I'm gonna pick up the legs, flex them at about 90 degrees, and I'm gonna look for the tibia to sag. And while I have them in this position, I'm gonna do the Loomer's test. So I'm gonna take the feet and externally rotate them. I'm gonna look for excessive rotation of the tibia, and this test also tests for the PCL. So I'm gonna be doing the reverse Lockman's test, testing the PCL. I'm gonna place my hand over the tibial flare, my other hand above the patella. I'm gonna try to push the tibia posteriorly, and I'm just looking for an end point. So I'm gonna be doing the posterior drawer test. So I'm gonna bring the knee to flexion about 90 degrees. I'm gonna sit on the foot, and I'm gonna try to push the tibia posteriorly. It's testing the PCL. And so I'm gonna be doing the posterior drawer test. So I'm gonna bring the knee to flexion about 90 degrees. I'm gonna sit on the foot, and I'm gonna try to push the tibia posteriorly. It's testing the PCL. And another test for the PCL is the reverse Lockman's test. So I'm gonna place my hand on the tibial shear. So I'm gonna be doing the anterior drawer test. So I'm gonna put the knee up in a flex position about 90 degrees. And I'm gonna sit on the foot like this. And I'm gonna try to pull the tibia anteriorly, testing for the ACL. And the Slocum's test, I'm gonna externally rotate the foot, and I'm gonna do the same motion, and I'm looking for anterior medial instability with the knee, and I'm gonna turn the foot, invert the foot. I'm gonna do the same thing. I'm gonna test for anterior lateral instability of the knee. I'm gonna be doing the pivot shift test, which tests the ACL and anterior lateral capsule instability. So there's 4 stages to it. First stage is internal rotation of the knee. The second stage is axial load. Third stage, valgus stress. And the fourth stage, you flex the knee. And you're looking for the tibial plateau to sublux. That'd be a positive test. If it's positive, you perform the Houston's test, which is just bringing the knee back down here, and you're just looking for the subluxation to go away. I'm gonna be doing the Lockman's test, and a test for the ACL. So I'm gonna put my left hand on the tibial flare and my right hand above the patella, and I'm gonna pull up on the tibia and push down on the femur to shear it. And you're looking for an endpoint. All right, so I'm gonna be doing the valgus stress test. It tests for the MCL, and you're gonna be looking for an endpoint. And then I'm gonna be doing the varus stress test, which tests the LCL, and you're also gonna be looking for an endpoint. So I'm gonna be doing the sweep test. So it tests for intra and extracapsular swelling. So I'm gonna put my left hand here and just sweep up towards the patella. And you're looking for fluid on the lateral side of the knee. So this is the palatable patella test. So I'm gonna push the patella down into the trochlear groove. And you're gonna look to see if the patella returns to its normal position. If it does, then the test would be negative, but if it doesn't, then the test would be positive. So I'm gonna be doing the Ober's test and a test for I-band tightness. So first I'm gonna ask my patient to lay on the side. So I'm gonna stabilize the leg and then put pressure on the pelvis. I'm gonna rotate the knee down towards the table. Test is a negative test if the patient's knee can hit the table, and if it's positive, his knee will not be able to hit the table. So I'm gonna be doing the Noble's test, and it tests for flipping of the I-band. So I'm gonna place my fingers on my patient's lateral femoral epicondyle. I'm gonna ask them to straighten their leg. And I'm gonna look to feel if I can feel the I-band flipping over the lateral femoral epicondyle.
And if you can feel that, then it is a positive test.
So I'm going to be performing the Q angle test. So I'm going to find my patient's ASIS, and then I'm going to place the axis of the goniometer on the tibial tuberosity with the stable lever arm in line with the tibia, and I'm going to measure up the femur to the ASIS to find the Q angle, and his Q angle is 7 degrees. So I'm going to be doing the Wilson's test and a test for osteochondral defect. So I'm going to internally rotate my patient's foot. I'm going to ask him to straighten his leg out. And if any pain occurs during one of these angles, I'm going to rotate my patient's foot out. And if the pain then goes away, then it is a positive test. So I'm going to be measuring the circumference of the knee, testing for any intra and extracapsular swelling or any atrophy of the knee. So you measure out, you start at the joint line, you place a dot, and then you measure 2 inches up from there until you get up to 10 inches. And so you measure the circumference around those. So first one's about 14 inches. Second one's about 15 inches. The next one's about 16.5 inches. And then 19 inches. And 21 inches. And the last one's is at 23 inches.